What is methamphetamine? Methamphetamine, also known as meth, is a highly addictive central nervous system (CNS) stimulant. In Indonesia and the Philippines, it goes by the names meth, speed, crank, and shabu, while the hydrochloride form is referred to as crystal meth, glass, shards, and ice. Let's take a closer look at the different forms of methamphetamine and how they appear. Powdered methamphetamine, also known as meth powder or meth dust, is a finely ground crystalline substance. It's the most popular form of methamphetamine and is often snorted by users. Some individuals may also dissolve it in water or alcohol for injection or ingestion. The color and texture of powdered meth can vary depending on the production ingredients. For example, cooking meth using red pseudoephedrine tablets may result in a pink or reddish appearance. Crystal methamphetamine, also known as crystal meth or simply crystal, is a translucent crystalline form of the drug. It's often compared to shards of glass due to its appearance. Crystal meth can be produced by dissolving powdered methamphetamine in a solvent, such as acetone or denatured alcohol, and allowing it to crystallize. Finally, there are methamphetamine tablets, such as disoxin, which is a pharmaceutical prescription drug. These tablets, also known as methamphetamine hydrochloride, and are legally available for medical use. The history of methamphetamine is a tale of scientific discovery, wartime use, and regulatory control. Let's journey back in time to explore its fascinating origins and evolution. Before the discovery of methamphetamine, amphetamine was first synthesized in 1887 in Germany by Lazar Edelianu. Then, in 1893, methamphetamine was synthesized from ephedrine by the Japanese chemist known as Nagai Nagayoshi. In 1919, methamphetamine hydrochloride, disoxin, was synthesized by Akira Agata through the reduction of ephedrine using red phosphorus and iodine. During World War II, methamphetamine was used by army troops to stay awake and alert, marketed in Germany under the brand name Pervitin. However, the side effects were later discovered, leading to a reduction in its usage by 1940. By 1941, its use was restricted to doctors' prescriptions and tightly regulated distribution. In the 1950s, methamphetamine was sold under the brand Obitrol following Pervitin. It became the first brand of pharmaceutical methamphetamine products and gained popularity as a diet pill in America during the 1950s and 1960s. Eventually, as the addictive properties were revealed, methamphetamine became a Schedule II controlled substance in the early 1970s in the United States. Currently, methamphetamine is sold under the trade name disoxin, which was once trademarked in Denmark and later sold to an Italian pharmaceutical company in January 2013. What's the usage of methamphetamine? Methamphetamine, known for its dual nature, serves both medical and recreational purposes. Let's explore its uses in each context. In the medical realm, methamphetamine hydrochloride, marketed as disoxin, is prescribed for the treatment of attention deficit hyperactivity disorder, ADHD, and obesity. It has been approved by the FDA but is prescribed in limited doses. To prevent toxicity, FDA guidelines recommend an initial methamphetamine dose of 5 to 10 milligrams per day for individuals over 6 years of age with ADHD. The dosage may be increased weekly by 5 to 25 milligrams per day, while the usual effective dose ranging around 20 to 25 milligrams per day. On the other hand, methamphetamine is also sought after for its potent euphoric and aphrodisiac qualities in recreational settings. Due to its effects on increasing libido and inhibiting ejaculation, some individuals engage in prolonged use, consuming methamphetamine for several days at a time. This subculture, often consisting of homosexual males, seeks methamphetamine specifically for its aphrodisiac effects. However, this practice poses a significant risk of increasing HIV cases within this demographic. Methamphetamine abuse can wreak havoc on both the mind and body, leading to a multitude of devastating effects. One may undergo loss of appetite, hyperactivity, meth mouth, high blood pressure, high blood temperature, sore on skins, accelerate heartbeat, weight loss, sexually transmitted infection, HIV, euphoria, lack concentration, fatigue, insomnia, changes in libido, anxiety, hallucinations, paranoia and others. The production of methamphetamine is a dangerous and clandestine process, often carried out in makeshift laboratories with little regard for safety or environmental impact. Methamphetamine exists in two enantiomers, levomethamphetamine and dextromethamphetamine. It is a racemic-free base, forming an equal mixture of levomethamphetamine and dextromethamphetamine. Levomethamphetamine and pseudoephedrine is available as an over-the-counter, OTC, drug, serving as an inhaled nasal decongestant in the United States. To provide a clearer picture, methamphetamine is synthesized by combining ephedrine or pseudoephedrine with other chemicals that are often poisonous or highly flammable. The mixture is then added to a solvent such as gasoline and heated to crystallize. Due to the lack of a quality control process, cutting agents can be added to dilute the drug. Example of cutting agents and chemicals are red dye, amphetamines, sulfur from ephedrine sulfate that result meth in orange color, phosphorus that result meth in purplish look, fentanyl and more. Drug addiction can be a devastating journey, but there's hope and healing to be found in drug rehab treatment centers. These centers offer a safe and supportive environment for individuals struggling with substance abuse to embark on their path to recovery. I will list the rehab centers below the bio. Hope it is helpful. The guide to understand methamphetamine is over. Hope this video can deepen your understanding toward methamphetamine, and don't afraid to seek for help if you or your family members is undergoing drug addiction.